A question that we get frequently at our Freedom Board, and that I used to get in emails a lot, was if secondhand smoke can cause a person to relapse. And it's an important issue because there's a lot of people who are just afraid of quitting smoking and thinking it's kind of a futile effort because they still have a lot of family and friends who smoke. People smoke in their homes. They go to certain places where smoking is still prevalent. And hey, when we're doing this in some major American cities where smoking is banned, this doesn't seem that big of an issue anymore. But we're dealing with a worldwide population here, and there are still populations where smoking is the norm in many circles, where there aren't many anti-smoking policies and people are exposed to cigarette smoke regularly. And if these people are working with the assumption that what's the use in themselves quitting because they're going to walk by a smoker one day and that'll do them in. Secondhand smoke is not going to put a person back to smoking. You do not get enough nicotine from secondhand smoke exposure. Nicotine has a very unique property. It settles out of the air almost instantly, once it hits. Other chemicals in cigarettes don't share this attribute, but nicotine does. And we're fortunate that it does. Because if it didn't, nobody would have ever quit smoking. You got to understand, the people you knew who used to smoke who don't smoke anymore, who quit 40 years ago and 30 years ago, and even 20 years ago, they were exposed to cigarette smoke everywhere. They were surrounded by it. Look at old movies and old clips from TV shows, and you could see that it was smoke-filled air. That's what people were generally exposed to. People would ride on trains and smoking would be there in closed-in environments. And it was incredible the amount of smoke that you would see in the air to people viewing it now. But back then, hey, that was the norm. Over half the men in our country smoked at one point in time. And they smoked everywhere. Nicotine settled out of the air almost instantly, though. And again, we're fortunate that it worked that way. Tobacco industries realized this very early on, and they used to say when there were ordinances starting to be put out, trying to restrict smoking in public places, they used to say that, secondhand smoke just really doesn't pose that much of an issue. And you know how they would base that determination? They say, well, you have to look at a chemical that's, not in anywhere else, just in tobacco, and measure that one chemical to get an idea of exposure of all chemicals. Let me explain what I meant by that. Carbon monoxide comes out in very high levels in tobacco smoke, very high levels, levels that can get dangerous for non-smokers exposed to it, especially non-smokers who have pre-existing health conditions. All right, so if you were to measure carbon monoxide levels in some very closed-in environments that people would smoke in, you would see they'd be sky high. But here's the catch. Carbon monoxide also comes from automobile exhaust. Carbon monoxide could be from, industrial kind of exposure. And the tobacco industry logic was, so you really can't say that if you're in a smoke-filled room and you get this real high level of carbon monoxide, how do you know it came from cigarettes? There's other sources of carbon monoxide. So let's not look at carbon monoxide. And then you can go down a list of all the other chemicals that cigarettes produce. Well, many of them occurred from other substances, so you had to take those out of the equation. Well, what's the one chemical that you could measure that is really only in cigarette smoke and nothing else? Well, it's nicotine. So let's look at nicotine levels in secondhand smoke and in the air. Well, it was very, very low. And now that was the argument of saying secondhand smoke wasn't dangerous. Again, this was a faulty argument because while nicotine settled out of the air almost instantly, these other chemicals did not. The carbon monoxide, the hydrogen cyanide. I mean, there's thousands of chemicals in tobacco smoke, and many of these things got into very high levels from secondhand smoke exposure. Now, there's exaggerations about secondhand smoke too to some degree. A common thing that some people had heard, like being around a smoker could be worse than smoking yourself. I used to hear that one a lot. And where that came from were statements that were made that being around a smoker could be more dangerous for the non-smoker in the room than the smoker in the room. Well, that's a true statement. But that's a different statement than saying it's worse than smoking yourself. Let me explain the difference between those two statements. How it could be more dangerous for a non-smoker than for the smoker is there's something wrong with the non-smoker. The non-smoker is allergic to chemicals in tobacco smoke. And that exposure, makes them sick on the spot. So yeah, you're going to say it's worse for the non-smoker than it is for the smoker. The non-smoker, is a cardiac patient who has limited lung function, maybe from their past smoking, maybe from other conditions, but they have oxygen problems. They're almost borderline needing to be on oxygen. Well, you throw a person like that into a smoke-filled room where carbon monoxide levels, again, can be going sky high. Hey, that exposure may give that person a heart attack on the spot. And if that were to happen, you would see that person laying on the floor having a heart attack and say, well, that was kind of worse for the non-smoker in the room than it was for the smoker. Yeah, it was in that case. But that's not saying that it's more dangerous to be around secondhand smoke exposure than smoking yourself. Because you can bet that if that secondhand smoke induced that attack in that non-smoker, if that non-smoker happened to have taken up smoking, last week, they were going to probably have that attack, days earlier, or if they did it last year, or who knows, how long back. If the secondhand smoke exposure could have done this to them, firsthand smoke would have done it a whole lot sooner. So, secondhand smoke does pose risks. Again, if people have allergies, if people have, bronchial asthma, and it sets off a bronchial asthma attack because of some sensitivity that individual has, yes, it's worse for the non-smoker. But again, that person would have had it a lot earlier, in all likelihood, if they were smoker themselves. So the important message in this one is secondhand smoke is not going to put you back to smoking. But that doesn't mean that you shouldn't avoid it when possible. Again, especially if you have a pre-existing condition and you just may find it makes you feel crummy. You'll hear some people who think that they might be having a slight little relapse kind of reaction, that they're in withdrawal, because hours after they were exposed to secondhand smoke exposure, they're kind of headachy and they don't feel well, and they equate that to withdrawal, and it's probably not withdrawal. It probably is the carbon monoxide level was high enough from that secondhand smoke exposure that they're feeling ill from it. They just don't feel good. You get used to feeling good when you're a former smoker, when you're not having the carbon monoxide kind of poisoning effects that you may have had as a smoker. But secondhand smoke exposure can throw those levels high enough to possibly cause some of those side effects. That's not nicotine withdrawal you're feeling. That's low oxygen levels and carbon monoxide, minor poisoning kind of effects you're feeling. So you do want to minimize, especially because keep in mind, a lot of people that watch these things, they're former smokers who have significant lung damage, who have conditions, that may have been what induced them to quit smoking. They might have pre-existing problems now, and secondhand smoke can very well be dangerous to them, and they should be able to avoid it if they feel they're in that category. So, all right, secondhand smoke will not put you back to smoking. There's only one thing that can do that, ever, and that's you taking, a puff. Again, firsthand smoke. Videos to look at that will kind of illustrate this issue are the Palmolive bottle one, because that one shows you how much smoke comes in compared to what comes out. And it's an incredible amount. When someone takes a drag on a cigarette and then blows out the smoke, 90% of the smoke in the particulate matter, the chemicals, they're staying in their lung. They're blowing out 1/10. And the odds are you're not standing right in front of them when they're exhaling and you're going trying to get it all in. And even if you did, you'd still only get, a fraction of the 10% that they had blown out. The smoke coming off the end of the cigarette, that could be pretty concentrated in chemicals, and that you kind of want to try to minimize exposure to. But again, it's not because of nicotine. It's because of, hundreds of the other 4,000 chemicals that are coming in that could be in very high dosages. Again, to avoid the risk, though, of ever exposing anyone else to your secondhand smoke, but the risks of really taking in these chemicals in quantities which are, toxic on a scale so far, different than what secondhand smoke would be. To avoid ever putting yourself in that kind of, category again, is still making and sticking to your personal commitment to never take another puff